Hey everyone and welcome back to our channel. Hope you all are doing well. Guys, today we are talking about something that's right under your nose, well more like under your skin. I'm talking about your pulse and what it can reveal about your overall health. Now I know most of us don't give much thought to our pulse, but the rate, rhythm and strength of your heartbeat can actually tell you a lot about what's going on inside your body. So in today's video, we are going to break down what your pulse says about your health, how to check it, and when you should be concerned. By the end of this video, you will have a better understanding of your heart health and how to listen to the signals your body is giving you. So let's first get to know what is your pulse. Alright, before we deep dive into what is your pulse, can you let's quickly review what your pulse actually is. The pulse is the rhythmic expansion and contraction of your arteries as blood is pumped through them by your heart. It's basically the sound and feel of your heart beating. Now you can check your pulse at various points in your body, but the most common spots are the wrist, on the thumb side, and the side of your neck, just under your jawline. All you need to do is to press gently with two fingers and you should feel a steady beat. The rate of your pulse measured in beats per minute can vary based on factors like age, activity level, and fitness. But here is the thing, your pulse doesn't just indicate how fast your heart is beating, it's a window into how your body is functioning as a whole. Let's look at what a normal pulse looks like and what can be wrong. So, what does your pulse rate mean? Now that we know what a pulse is, let's talk about the pulse rate. Generally, a normal adult resting pulse should be between 60 and 100 beats per minute. But what if it's faster or slower? Let's break it down. First is a fast pulse. If your pulse is consistently over 100 beats per minute or at rest, this condition is called tachycardia. It could be due to things like stress, fever, dehydration, or even more serious conditions like heart problems or an overactive thyroid. If you notice your heart racing for no clear reason, or if it happens regularly, it's a good idea to see a doctor. Second is a slow pulse. On the flip side, if your pulse is consistently below 60 beats per minute, that's known as bradycardia. Now, some athletes or highly fit individuals may have a lower resting pulse, and that's completely normal for them. But if you are not an athlete or your pulse is unusually slow, it might be signal an issue with your heart's electrical system, or it could indicate hypothyroidism, electrolyte imbalances, or other conditions. But pulse rate is only part of the picture. Let's look at the rhythm text. So, what your pulse rhythm says about you. The rhythm of your pulse, how steady or irregular it is, can tell you even more about your heart health. First is regular rhythm. If your pulse is steady and rhythmic, that's a great sign. It means your heart is beating efficiently and your electrical system is functioning well. Second is irregular rhythm. But if you feel your pulse skipping beats or if it feels erratic, you might be dealing with arrhythmia. This is a condition where the heart's rhythm becomes irregular, very too fast or very too slow. Some are harmless, but others can be quite serious and lead to things like stroke or heart failure if left untreated. If you notice a fluttering situation in your chest, lightheadedness, or fainting spells along with an irregular pulse, definitely you should consult with a healthcare professional. It's important to get checked out to rule out any underlying issues. Now let's look at the pulse rate and what it means. Now let's talk about the pulse rate, how strong or weak your pulse feels. This is a bit less talk about, but it can provide valuable insight in your health. First is strong pulse. If your pulse feels strong and easy to detect, it typically indicates good blood flow and healthy cardiovascular function. Second is weak pulse. A weak pulse can sometimes indicate that your heart isn't pumping blood efficiently. It could be a sign of dehydration, blood loss, or in more severe cases, heart failure. If you are finding your pulse unusually weak or hard to feel, it could also be a sign of issues like low blood pressure or peripheral artery disease. So when you should be concerned and what to do. So when you should actually be concerned about your pulse. Here are a few of the signs to watch out for. If your pulse is consistently above 100 bpm or below 60 bpm, or if it's erratic or irregular, you should seek medical advice on priority. If you experience chest pain, shortness of breath, dizziness, or fainting alongside an abnormal pulse, don't wait, go see a doctor immediately. Also, if you notice sudden changes in your pulse after physical activity, or if you experience an extreme fatigue, this could be signs that something is off. Remember, guys, your pulse is just one part of the puzzle when it comes to your heart health, but it's an important clue. So, there you have it. Your pulse is more than just a heartbeat, it's a window into your health, giving you clues about how well your heart and body are functioning. Whether it's the rate, rhythm, or strength, paying attention to your pulse can help you catch potential issues early. If you are ever unsure or notice something off, it's always best to check in with your healthcare professional. So, if you found this video helpful, don't forget to give it a thumbs up and hit that subscribe button if you haven't already. I'm posting videos just like this every week to help you take care better of your health. And if you have any questions or experiences with pulse changes, drop them in the comments below. I would love to hear and support you. So, thank you so much for watching, and I will see you in the next one. Stay healthy and take care of your heart. Thank you.